Good to meet you. You are the co-founder and chief operations officer at Beam Health, I understand.
That is right.
A telemedicine company. So I want to understand, what is Beam Health? Help me and everyone watching understand what you're doing.
Yeah, absolutely. Thank you, Logan. So Beam Health is the first two-sided marketplace for virtual care. Okay. So essentially, when you look at the telemedicine space, right, it's a very hot field in healthcare, and you have companies like Teladoc, PlushCare, American Well, essentially hiring their own doctors to deliver video consultations to patients. Yeah. So what they're building is a typical medical practice in the virtual plane. Sure. Now the next evolution of telemedicine is going to be a marketplace where patients can go to evaluate and discover different telemedicine options. That's what we're building.
Okay. Why are you passionate about this? What got you into this?
Yeah, absolutely. So I spent the last 5 years of my career at Bristol Myers Squibb. A lot of that time was spent directly with physicians as well as in doctors' offices, just seeing how patients interact with their healthcare providers. And what I know to be true, and what every physician knows to be true, is that it's way too difficult for patients today to consume services, and it's more difficult than it has to be for providers to sell services, right? Tech companies have come in and disrupted just about every major industry out there except for healthcare. Yeah. And what's unsettling to me about this is that in the context of healthcare, we're not talking about people trying to purchase a product on Amazon or someone trying to hail a ride on Uber. Yeah. We're talking about patients who have real diseases and who aren't as engaged in their own health because of how intimidating it is to purchase healthcare services.
Okay, so walk me through it. Let's talk about the product. What does the platform look like?
Yeah, absolutely. So we actually just secured providers in all 50 states.
Fantastic.
So we're really happy about that. But essentially, it's similar to Amazon in that any doctor, any private practice, hospital, or telemedicine company can list their services on our marketplace for free and then acquire new patients. Okay. So from the patient end, you sign on to the platform, or you just...
I have a health event. I want to have a telemedicine visit. As a consumer, I can sign on to Beam Health?
That's right.
Or will it be a white label on the back end of my provider?
So it's a little bit of both. Okay. So what the patient would initially do is sign on to our website, input the state they're in and what specialty they're looking to deal with, and then they'll see a bunch of different options that they can choose from. Okay. They'll also be able to put their member ID and their payer name and find out which providers take their insurance and find out exactly what their out-of-pocket is. Nice. And then they would schedule a consult with the provider, phone or via phone or online. At the time of the consult, the provider would use our HIPAA-compliant app to initiate a video consult with the patient. A key piece here is that patients don't need to download anything. So they would just receive a text message at the time of the video consult with the link to essentially the video chat that'll open up their web browser. Yeah. So the way we do it is, for patients, it's very, very simple. You register once, you search for a provider, and then you schedule a consult. Nice. And then for the provider end, all they have to do is open up the app, search for a patient's name, and initiate a consult. Yeah. So the most important thing there is that providers don't need to be trained. We all know doctors hate learning a new software platform, so we've built what we say is the easiest platform to use in healthcare. Okay. Well, that kind of gets at my next question, which is anyone who's been in telemedicine knows that it's taken a while to take off. Sure. You know, it's been this, it's been a concept with promise for a decade, 2 decades, and you could go way back. Why is it taking so long for telemedicine to take off? That's a great question, Logan, and we know this really well. So our CEO and my co-founder, Sas Panapali, was the founding chief technology officer of PlushCare, which is a venture-backed telemedicine urgent care right here in the Bay Area. They run that typical model of hiring their own doctors to then do video consults, and they've been very successful. But the way I look at it is, again, these companies are just creating their own telemedicine practices. Got it. We think that the reason telemedicine hasn't taken off is because it's still too difficult for consumers to find the services they need via telemedicine. The other thing I'll say is most of what doctors do will still be in person, right? Or at least a certain portion of that. You may have an operation and then require 5 follow-ups before you need to go in person the next time, right? So if you're dealing with a telemedicine urgent care that cannot have in-person consults, it simply won't work there, right? So in our marketplace, you can find a provider that has a real brick and mortar location, that has a nurse, a PA. You can go into the office, get what you need in person, and then follow up via telemedicine. But I think really our mission is to lower the barrier of entry for both providers and for patients. Gotcha. That's what two-sided marketplaces accomplish. That's what Uber did, again, in the transportation space. That's what Amazon did in retail. We are the only company with this vision in the telemedicine space, and that's why we believe we're going to bring it forward.
Awesome, Ranga. Well, fantastic. Great to meet you, hear more about Beam Health, and wish you the best at the festival.
Thanks so much, Logan.
All right.